Good morning, and hello, my colleagues and my friends and my fans and my students everywhere. Bismillah ar-Rahman ar-Rahim. Today I will speak about, as a continuation of my speech about edema in clinical practice. I will talk about a specific type of edema or entity of edema, which means accumulation of fluid in some part or in some tissue or in some organ inside the human body. And this is cerebral edema. Cerebral edema means, or sometimes we call it brain edema, means accumulation of fluid inside the parenchyma of the brain, which causes volumetric enlargement of the brain tissue and the neuronal cells. In fact, the edema may be at the level of the cells, may be at the level of the interstitium of the brain, or at the level of the parenchyma of the brain. And this is the whatever the type of the edema and its site or its anatomy inside the brain, it will have disastrous effects of or on the brain. Brain edema may be diffuse or localized, maybe focal or diffuse, maybe localized or generalized in the brain, depending on the underlying pathology. So whether it is focal or diffuse, localized or generalized inside the brain, it will have disastrous effects. And the most dangerous is that it causes elevated intracranial pressure or rise of the pressure inside the skull, with its disastrous effects on the brain function and then on the life of the patient, because it might cause herniation of the brain, and this will have a direct effect on the brain stem and the vital functions in the brain stem, and may result in death through tentorial herniation as a result of the intracranial hypertension or elevated intracranial pressure. Not only this, the cerebral edema also affects the brain function, both directly by affecting the cellular function, and indirectly by interfering with the blood supply of the brain. And as we all know, the blood supply of the brain is essential to supply the neurons with the essential nutrients, especially glucose, and also with oxygen. So interference with the blood supply of the brain will interfere with the oxygenation and metabolism or nutrition of the neurons or the brain cells, and will result in its damage and ultimately at the end brain death. And this is the ultimate end result of cerebral edema of whatever etiology, is brain death and death of the patient at the end. So that's why cerebral edema must be recognized. The underlying cause must be identified, and prompt and urgent management should be given to the patient. Regarding the mechanisms and types of cerebral edema, we have many mechanisms, or one of four mechanisms. Number one is the what we call vasogenic type, or the vasogenic mechanism, in which the cause of the edema is disruption of the cerebral capillary endothelium at the level of the brain blood-brain barrier, and this will result in extravasation of fluid inside the brain. So this is the first mechanism, the vasogenic cerebral edema, due to disruption of the cerebral capillary endothelium, that is capillary endothelial damage at the blood-brain barrier and resulting in cerebral edema. The second mechanism is cytotoxic brain edema or cytotoxic mechanism of cerebral edema, and this is due to malfunction of the cellular metabolism. It's due to malfunction of the cellular metabolism, resulting in extravasation or cellular edema and the development of brain edema. So this is what we call the cytotoxic mechanism, or the cytotoxic type of brain edema due to malfunction of the cellular metabolism by direct and indirect insults to the cell. Number 3 is the interstitial type of cerebral edema, and this is due to obstruction of the cerebrospinal fluid circulation, as occurs in obstructive hydrocephalus, and this might result in also an interstitial type of cerebral edema. And then we have the osmotic type of cerebral edema due to changes in the osmotic pressure across the neuronal membrane, and we result in extravasation of fluid from inside to outside the cells, resulting in brain edema. So the mechanisms, again, to repeat again, are one of 4, either vasogenic or cytotoxic or cellular, sometimes we call it, or interstitial or osmotic. These are the mechanisms and types of brain edema, but whatever the mechanism, the cerebral edema will stem from any of the following causes, and this is what we call the etiology of cerebral edema. That is, any of these etiologies which I mention, is resulting from any of the mechanisms or the types which I already mentioned, whether the vasogenic or the osmotic or the cytotoxic or the interstitial types of cerebral edema. The most common causes are which leads to these mechanisms of cerebral edema or types of cerebral edema are: number 1, traumatic brain injury, and this is the first cause, is trauma, brain trauma, traumatic brain injury, or what we call the TBI, as a result of head trauma. And in head trauma, in fact, the cerebral edema is of mixed types and mixed mechanisms, and it might be either focal or diffuse, localized or generalized cerebral edema, depending on the type and severity of trauma to the head. But it is usually mixed in nature or in type, the cerebral edema following traumatic brain injury. Number 2 is, and this is one of the commonest causes of cerebral edema, is vascular insult to the brain. That is stroke, cerebrovascular stroke. Cerebrovascular strokes is one of the commonest causes of cerebral edema we see in clinical practice, and the commonest is the ischemic stroke due to thrombotic stroke or embolic cerebrovascular stroke, with resulting damage to the brain substance and edema surrounding the infarct. This is what we call peri-infarct edema. So here the cerebral edema is complicating vascular insult to the brain, that is stroke, ischemic stroke. Also, it might complicate cerebral hemorrhage, that is hemorrhagic stroke. Also, hemorrhagic stroke might be complicated by cerebral edema, diffuse or focal, localized or generalized, depending on the severity of the hemorrhage inside the brain. Also, it might complicate cerebral venous sinus thrombosis, which is another vascular insult to the brain at the level of the cerebral venous sinuses. So any of these vascular brain insults may be complicated pathologically by cerebral edema. Another etiology is the tumors, of course. Tumors like brain meningioma or metastasis even. So metastatic or primary brain tumors might be complicated by cerebral edema, which might be also focal or diffuse. Any type of brain tumor, whether primary brain tumor, especially gliomas and meningiomas, or secondaries in the brain, that is metastasis from another solid cancer in the body inside the brain, might be the cause of cerebral edema. Then we come to the infections as a cause of cerebral edema. Any of the intracranial infections might be complicated by cerebral edema, most commonly due to meningitis, whether it is bacterial or viral or fungal meningitis or aseptic meningitis. Any cause of meningitis, bacterial or non-bacterial, will be associated with cerebral edema. Encephalitis also, and the most common is viral encephalitis, will be complicated by cerebral edema. Subdural abscess might be complicated by edema. Any type of brain abscess might be complicated by edema. Any type of brain cyst, that is cystic disease inside the brain, or space-occupying lesion, may be complicated by surrounding brain edema. So this is what we call tumors as a cause of cerebral edema. Also, metabolic derangements as a cause of cerebral edema, most commonly in acute liver failure. And this usually happens between stage 3 and stage 4 hepatic encephalopathy. And the patient develops cerebral edema within few hours after the onset of hepatic coma, and is associated with high morbidity and high mortality and brain death. So brain edema complicating hepatic encephalopathy, brain edema complicating diabetic ketoacidosis, and rapid lowering of blood sugar in patients with diabetic ketoacidosis. So we have to avoid rapid lowering of blood sugar because of the possible risk of development of cerebral edema due to management of patients with diabetic ketoacidosis. So diabetic ketosis also another cause. Hyponatremia is another electrolyte disturbance which might be associated with edema and myelinolysis, and the rapid correction of hyponatremia itself might result in worsening of the cerebral edema. So we should also be careful when we manage and give the patients appropriate intravenous fluids and sodium solutions in patients with hyponatremia to avoid further deterioration of the cerebral edema. So cerebral edema might complicate sodium homeostasis disturbance, especially hyponatremia. So these are examples of metabolic causes of cerebral edema: the encephalopathy, the metabolic encephalopathy of liver cell failure, the metabolic encephalopathy of renal failure, the metabolic encephalopathy of hypoxic respiratory failure, the metabolic encephalopathy of electrolyte disturbances in diabetic ketoacidosis patients. These are all causes of metabolic causes of cerebral edema. Also in patients who have what we call hypoxic injury as mountain climbers, so they might develop the individuals who climb mountains and they hike over mountains, they might get what we call acute mountain sickness or high altitude cerebral edema, and which is dangerous. High altitude cerebral edema, that is cerebral edema developing at high altitudes due to hypoxic injury to the brain, and this is a common complication of high altitude seekers and climbers of the mountains. So this is another injury or another form of causes of cerebral edema due to physical factors and high altitude hypoxia. And also this might be, cerebral edema might be caused by certain drugs or worsened by certain drugs, so we should be careful about this. This is the mechanisms and the causes of cerebral edema. I have another presentation about the diagnosis and management of cerebral edema. another presentation.